This video will give an introduction to plans of care and how to document within a plan of care. In Interactive View, we did a falls risk assessment and we documented that the patient had had a fall. This generated a suggested plan of care for our patient. If we navigate to our order screen, we can see over here that we have suggested plans for our patient. If we double click onto suggested plans, it will show us what plans are available. And because we documented that our patient had a fall, we now have a falls risk plan of care suggested. Click on the falls risk plan of care and click on accept to accept this plan of care. This plan of care has a group of outcomes at the top, and we can tick or untick these outcomes for our patient. You'll see that we also have patient-specific goal 1 and 2. Then we have a group of orders of interventions, and again we can tick or untick them as appropriate for our patient. The patient-specific goal that we would like to add to this plan of care for our patient is that the patient remains free from falls for 48 hours. I will tick to select the goal, and then I will right-click and modify and enter the goal here in the description. That is now documented up here in Outcomes. For my interventions, I will instruct the patient to call for assistance when getting out of bed and consider supervision for showering and toilet. Now that I have selected the outcomes and the interventions that I would like for my patient, I will now click Initiate so that this plan of care will become active for my patient, and I will click Sign. I will refresh my screen, and the plan of care now sits here in our patient's chart. The plan of care is required to be completed each shift. You'll need to check with local workflows if a progress note is also required in addition to documenting within the plan of care. To document within the plan of care, first we need to be clicked onto the falls risk plan of care in our order screen, and then we will click on the Document in Plan tab, which is here. Only document against the outcomes and interventions that you have actually done for your patient. If they have not been done, please do not chart. If you have instructed the patient to call for assistance when getting out of bed or mobilizing, you can click the tick here, and over to the right hand side of the screen it will document that we have done this, or alternatively we could tick not done. We can also put in any information here in outcome variance. Then we can click Sign Documentation. We now see that that intervention was done on the 3rd of December at 14:42. At the end of each shift, we need to come to the Document in Plan and document accordingly for our patient.